Hello, everyone. I will be presenting an overview of psychological assessments and why they are important. This presentation is part of a series of presentations that the Wellness Center has prepared for World Mental Health Day 2022. My name is Asia, and I am a psychometrist at the Wellness Center in Grand Cayman. As a psychometrist, I administer and score psychological tests. We'll discuss more about the role of a psychometrist later. My presentation is composed of the following topics. What is psychological assessment? What is psychological testing? Who conducts assessments? The process of assessment, and the importance of assessments. Let's dive into what psychological assessments are and differentiate them from psychological tests. Psychological assessment is the process of gathering, integrating, reviewing, and interpreting psychology related data to make a psychological evaluation. Psychological assessment involves more than just testing. It uses tools such as interviews, case studies, behavioral observations, and specially designed apparatuses such as psychological screeners and tests. It aims to answer a referral question, which is the question we are trying to answer that led to the assessment, solve a problem, or arrive at a decision, such as school or special program placement. Assessments are individualized. This means that an assessment is tailored to the needs of one specific person. After gathering all preliminary and background information, the psychologist analyzes the information and comes up with an assessment battery that will address the needs of one client at a time. On the other hand, a psychological test is a set of items that are designed to measure characteristics of human beings that pertain to behavior. It may measure different sorts of psychology related attributes such as math ability, depression and anxiety levels, personality, and many more. Some examples of popular psychological tests are the Stanford Binet Intelligence Tests, the Myers-Briggs Type Indicator, the Rorschach Ink Blot Test, and the 16 Personality Factor Questionnaire. Conducting a psychological test results in a score that is usually numerical and may be administered to an individual or to a group. There are different types of psychological tests: ability tests and personality tests. Ability tests measure skills in terms of speed, accuracy, or both, and are further divided into three types: achievement tests, aptitude tests, and intelligence tests. Achievement tests measure previous learning, such as spelling or math tests taken in school. SATs and ACTs are also achievement tests that measure a person's college readiness. Aptitude tests measure one's potential for learning a skill. For example, how easy it would be for a person to learn how to bake a pizza. Intelligence tests measure a person's general ability to solve problems, adapt to changing experiences, think abstractly, and profit from experience. An example of this is the Wechsler Adult Intelligence Scale, or the Wechsler Intelligence Scales for Children, which provides a full-scale IQ score. On the other hand, personality tests measure a person's typical behavior. Structured or objective tests present a statement that a person responds to. Responses may come in the forms of yes or no, true or false, or a Likert scale, which presents options like always true, sometimes true, or never true. One example of a structured or objective personality test is the 16 Personality Factor Questionnaire. Projective tests provide an ambiguous stimulus that an examinee tries to interpret. An example is the thematic apperception test, wherein the examiner presents a picture and the examinee tries to narrate what is happening in that picture. There are four important characteristics that the psychological test must have. First, it must be standardized, which means that the test is uniform from one examiner and from one setting to another. The same questions, materials, and instructions are presented to the test taker and is administered in a neutral environment free from external distractions. Usually, a testing room is plain and undecorated, free from clutter and unnecessary items or furniture, and is away from potential noise. Next, a psychological test must be objective. Objectivity means that the test is independent of the subjective judgment of any particular examiner. Any test taker should obtain the same scores regardless of who the examiner is. Third, a psychological test must be reliable. A test taker must obtain the same score when retested with the identical test or an equivalent of the test. For example, taking one IQ test should yield the same IQ score as when one takes a different IQ test. Finally, a psychological test must be valid. A valid test shows that it measures what it is supposed to measure. An English test must evidently measure English achievement, and a performance test must evidently measure one's performance. Basically, psychological assessment aims to answer a referral question, solve a problem, or arrive at a decision. It is tailored to fit the needs of one individual and is led by a psychologist. On the other hand, psychological testing is one component of the whole psychological assessment. It aims to obtain scores that are usually numerical, may be administered to individuals or groups, and is administered by either a psychologist or a psychometrist. Who conducts psychological assessments? There are several professionals who work with assessments. Clinical psychologists hold a doctorate or master's degree and specialize in providing continuing and comprehensive mental and behavioral health care across the lifespan. They may provide psychotherapy services or counseling and are licensed to diagnose. Their specializations include assessment using interviewing, behavioral assessment, and administration and interpretation of psychological test measures. Developmental psychologists also hold a doctorate or master's degree and specialize in human growth and development that occurs throughout the entire lifespan. This development does not include only physical development, but also includes cognitive, social, intellectual, perceptual, personality, and emotional growth. In most countries, they are also licensed to diagnose. Educational psychologists also hold either a doctorate or master's degree. They specialize in supporting children with learning difficulties or communication needs. Educational psychologists work in collaboration with schools, specifically teachers, guidance counselors, and learning specialists to help meet the needs of young people who are finding it difficult to manage their emotions or perform to their best ability in academics. Psychometrists like me hold either a bachelor's or master's degree. A psychometrist's main task is to support the leading psychologist by administering and scoring psychological tests under the supervision of a psychologist. After administering and scoring a psychological test, scores and all other data gathered, such as background information, family history, medical and developmental history, and other relevant information are integrated and interpreted by the psychologist. In summary, psychologists lead the assessment process by determining the assessment battery and direct the psychometrists towards what tests to administer. The psychologist also interprets assessment results and writes the psychological assessment report, conducts therapeutic interventions, and supervises psychometrists. Now, let's look at the process of psychological assessments. The assessment process starts with a referral. A referral is made by a psychiatrist, another psychologist, therapist, physician, pediatrician, guidance counselor, or other mental health providers. This referral tells the testing psychologist what exactly to test for. The next step is the intake interview. During the interview, comprehensive information regarding the individual's symptoms, medical and developmental history, academic performance, and all other important information is gathered. After that, the psychologist or psychometrist conducts a home or school observation to see how the individual typically behaves. Next, direct psychological testing is commenced. The psychologist or psychometrist administers and scores the psychological tests determined in the assessment battery by the psychologist. These scores are interpreted and integrated with other collected data and information to arrive at a diagnosis or to make a decision. The test results, diagnoses, and treatment recommendations are discussed during the assessment feedback. Then, the client is referred to an appropriate provider of therapeutic services such as psychotherapy, behavioral therapy, speech and language therapy, or occupational therapy. Why are psychological assessments important? Let's look at the utility of tests in different settings. Psychological assessments are useful in the school setting to assess the need for educational intervention or to establish or rule out eligibility for special education programs. For example, assessments are conducted to determine if a student is eligible to enroll in a special advanced class and to determine if they have the aptitude to succeed in an advanced program. Assessments also help in the construction of an individualized education program or an IEP. An IEP uses the scores obtained in the assessment to identify the area that a child struggles with and contains your child's present level of performance in school, individualized instructions, and supports like exam accommodations and assistive technology. IEPs are found to be crucial in helping students perform to the best of their ability with the support of exam accommodations like extra time during tests, allowing them to take more breaks between tests, and allowing them to use laptops for writing and written tests. In the clinical setting, psychological assessments are mainly used to assess a person's cognitive abilities, personality, social skills, emotions, behavioral responses, or interest in order to arrive at a diagnosis. Assessments are helpful because they guide treatment and therapeutic interventions. For example, it has been found that dialectical behavior therapy is most effective for persons with borderline personality disorder. Without a proper psychological assessment and a formal diagnosis of borderline personality disorder, a person suffering from such a disorder might become distressed due to the symptoms they are experiencing and might not receive the most applicable treatment and intervention. Being able to provide the most applicable treatment and intervention surely will more effectively address the symptoms a person is experiencing and will help improve that person's quality of life. In the industrial setting, psychological assessments are used in the selection and classification process of hiring. In research, assessments are also useful to gather data regarding a certain demographic. For example, psychological assessments are helpful to know if prescribing antidepressants to persons who are diagnosed with major depressive disorder is effective. Understandably, some of us might not want ourselves or our children to be diagnosed, as diagnoses does come with a stigma. We get apprehensive by the thought of being labeled and seen not as a holistic person, but as nothing more than a diagnosis. However, as mentioned earlier, receiving a diagnosis is critical in providing accommodations and support, such as exam accommodations, therapy, and being able to join support groups. It also provides opportunities for individuals to have access to resources and improve their quality of life. On a more personal side of things, getting a diagnosis may help a person in understanding why they experienced whatever symptoms they have experienced and provide enlightenment to any questions they might have had. That's the end of my presentation. Thank you to everyone who listened and showed interest in psychological assessments. Please scan the QR code and provide us with feedback to let us know how we did. Thank you.